Well, obesity is a chronic disease which affects around 650 million people worldwide. It has serious consequences for the individual and also for the society. It is a disease with several complex underlying biologies, and there's so much that we don't know. And we need to increase our level of knowledge to get the right treatment to the right patient at the right time. And this is exactly where an IMI project can pull together people from across the different stakeholders, academia, industry, and several other places. And together we can work and create that knowledge that is so absolutely needed in obesity.
SOPHIA is a 5-year project where we're going to discover the predictors of obesity risk, so which patients will develop complications of obesity, and we will also discover the predictors of obesity response, so which patients will respond to specific treatments.
So the partners within SOPHIA are from 4 different sectors. So we have the pharma sector, the pharma industry, represented by Novo Nordisk, Eli Lilly, and Boehringer Ingelheim. And we have the medtech industry through Medtronic represented in the project. And then we have patient organizations like JDRF, Type 1D Exchange, and Obesity Action Coalition, and roughly 22 different academic partners that are based throughout Europe, actually really with a very wide footprint within Europe and the US and the UK. And so it's really representing the whole community and the patients living with obesity in Europe. And together we have different perspectives, different strengths, and different skills and assets that we bring together in this partnership.
Well, the really great thing about the federated database system that we're setting up in SOPHIA is that it enables us to perform powerful statistical and machine learning analyses on multiple cohorts in parallel at a distance without any of the sensitive clinical data being copied anywhere.
Considering the traditional simplistic view, some individuals with overweight or obesity do not have any evident cardiometabolic effects, a phenomenon known as metabolically healthy obesity. SOPHIA will replace this simplistic view by defining many distinguishable subpopulations living with different types of obesity. We will use comprehensive clinical, molecular, and genetic information to identify risk factors for developing obesity and predict risk of obesity-related complications.
The mainstay of treating diabetes is weight loss. And there's a number of ways that patients can try and lose weight, and there's particular treatments we can also give to try and help weight loss. So people can try diet and lifestyle. There's diabetes medication that improves diabetes control but also causes weight loss. And then there's surgery for weight reduction. Now, for each of those treatments, there are some people who effectively lose weight and some people who don't. So we can give a diabetes treatment. Some people will lose 10 kilograms in weight and some people lose none. And what we want to do is understand who are the people who are going to lose weight so we can target treatment to them, or maybe try a different treatment for the people who aren't likely to respond to that drug.
Predictors of response to different treatments of obesity are particularly welcomed by the subjects affected by obesity, because these markers can help doctors to choose the most effective strategy when treating the patients. Also, it is very important to discover and validate biomarkers of risk, which can help predicting risk of cardiovascular disease, type 2 diabetes, and non-alcoholic steatohepatitis. In addition of the advantage for the patients, there is also an advantage for pharmaceutical companies because finding surrogate markers will permit substantial cut of the costs of clinical trials and subsequently of the drugs.
We used to think of people with type 1 diabetes as skinny people because we were putting them on very strict diets in order to keep their glucose control. But with the advent of new technologies, of insulin analogs, we have loosened diets. And so now people with type 1 diabetes look just like the rest of the population with a growing problem of overweight and obesity. In SOPHIA, we brought in type 1 diabetes to answer very relevant questions, namely, is there an impact of being overweight or having obesity on diabetes complications in people with type 1 diabetes? On the other hand, do people with type 1 diabetes respond in a different way to approaches of weight lowering interventions? And finally, we want to answer the question whether overweight or obesity contributes to the pathophysiology of type 1 diabetes.
Once you've worked out what your common language is, and that's in terms of scientifically accurate, as well as how it's used as well, in a really clear classification, we then move on to be blunt, what's in it for me? Regardless of the lens that you're looking through, be it a person with obesity, be it health professional, be it a regulator, whoever, it always starts with what's my lens? And then you start to see a thread of, what's the consensus? What can we all get behind that we can see that there's a benefit, not just from my particular lens, but actually for society as a whole and for better health outcomes. And that is how using a shared value approach will benefit everybody, but especially patients and people with obesity, because if only one stakeholder is behind this, good luck with uptake. We all need to be behind it, and we all need to have a shared value to do that.
Now, listening to patients living with obesity is a key aspect of SOPHIA and reminds us of a few key points. First is that obesity is complicated. Individual experiences widely vary, and we have to be cautious making assumptions about the contributors and solutions on an individual basis. Obesity, its causes and complications aren't often what we think they are. Second, that despite growing disease recognition by healthcare providers and the public, patients are rarely given a diagnosis of obesity. Unfortunately, people with obesity are almost always relying on self-diagnosis, another way that obesity is treated differently than other diseases. And finally, stigma, bias, and shame continue to dominate the lives of people living with obesity, as well as those seeking help for their obesity. And challenging such stigma and shame takes evidence and data like we're ultimately going to produce with the SOPHIA project. I'll end with a thank you to all the patients who have already contributed and will contribute to the future of SOPHIA.